name is Susan Salvo, and today we're going to be reviewing Swedish gymnastics. Your client is face up on the table. There are a few moves we're going to do face down, but most of the moves are face up or supine. The Swedish gymnastic movements we're going to do is going to be on the neck, the shoulders, the hips, and the feet. Okay? So we're going to start off at the neck. The first move I'm going to do is going to be a cervical rock or a head rock. I'm going to take my top hand, put it on the forehead. I'm going to move her toward me just with my fingertips. I'm going to take my other hand, and again, using my fingertips, I'm going to work the tissue in the lamina groove, just the area between the occipital bone and the area of her neck that meets her upper traps. So that you're going to start with the head in a neutral position, tilt back. Now once I get her going, it becomes a push-pull, moving the fingers in the lamina groove, and I'm using my heel of my hand to push her away from me. So push, pull, push, pull, push, pull. There's a little bit of movement on my bottom hand, but not a lot, going up and down the spine. After you do this about 6 times, I'm going to take my hand, I'm going to take my thumb, put it against her cheekbone or zygomatic bones, take my fingers, put it on her occipital bone. I'm going to rotate her head into my open hand, and I'm going to move my arm down to get it flat. Now I'm not lifting her up off the table, she stays down. Taking my other hand, anchoring the shoulder, now I'm going to move around the table. So I'm going to stretch her toward me while I'm keeping that shoulder anchored 3 times. And I'm going to take her face, I'm going to unrotate it, I'm going to slide her back of her head on the table to stretch her neck laterally, like this. And you can do that on both sides of the body. Then what I'm going to do is I'm going to take my left hand, I'm going to cup her occipital bone, take my right hand, I'm going to scoop up under her neck, grabbing her opposite shoulder. Now I'm squatted down a little bit. I'm going to stand up, and I'm going to move the chin to her chest, hold it for about 3 seconds, come down, and that completes the neck section. Keep in mind we're doing all these movements except for that forward flexion on both sides of the body. I'm going to walk down now to her shoulder. I'm going to start with a tapping of the arm, and I'm going to continue that tapping, that traction, and I'm going to go up all the way over her head. Coming back down to the side, taking her arm, moving it across her chest, holding it about 3 seconds, coming down, putting her hand back down to her hip. Now what I'm going to do is I'm going to take my top hand or my left hand, reach across, grabbing her wrist. I'm going to pull her hand down, causing some traction into the shoulder. I'm maintaining that traction while I'm going up, 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 all the way over her head. Now when she gets here, still maintaining the traction, I'm going to take my right hand, I'm going to cut just inside her elbow, maintaining the traction all the way down to where her hand is down to her hip again. Traction, 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 up over her head. Traction with the elbow all the way down to her hip. And you're going to do this movement 3 times. Placing her arm back on the table, working now onto the leg. Going to tap the thigh on the table. Start with rocking it. This is called a hip rock, even though I'm way down here by the foot, because the activity is going on in the hip. You can do bigger circles if you're comfortable doing so. Now what I'm going to do is I'm going to dorsiflex her foot, taking the heel of hand into the ball of the foot, pressing quite a bit, using my whole body weight in this move, holding it. Plantar flex, holding it. Dorsiflex, holding it, and you can do that several times, okay? Pull and stretch the toes. She's got great toes. And you can circumduct each one. Then I'm going into the metatarsal scissors. Isolate it, you can compress, and move the foot this way. This seems to be a favorite one for massage therapists and clients alike. Wonderful. Now, walking up to her knee area, I'm going to take my left hand inside the knee area. Now when I bend this, my right hand's going to go to the plantar surface of her foot. Now as I'm bending it, I want you to notice that you just kind of rest on the sides of my hand here. I'm coming up. I've stepped up now. I'm at her hip level. Going to now grab the base of her foot, the plantar surface of her foot, and I'm not going to twist. I'm not going to rotate the hip, keeping it nice and straight, going to her shoulder in a 12 o'clock, holding it for a moment, releasing the pressure, but I'm not moving her way back down here. I keep it kind of close and tight. Then going to her opposite shoulder in a 2 o'clock position. Then I'm pulling it back to go to the tabletop in a 10 o'clock position. Do that once, twice, or thrice. Imagining that I am circling her knee on the rim of a bowl now, pushing, pushing, pushing 3 times, and then rotate it the other way. 2, 3. Take my bottom hand, let it join the knee. Take my top hand, let it join the shoulder. I'm not compressing down, I'm compressing, or moving her across, and let her knee touch the table's edge if she can. Some people can go less, some people can go more. Hold it. Then take it, release the stretch, take the foot, put it to the thigh or the knee, and then you're just going to let it drop out for a groin stretch. Her hand's in the way, so I'm just going to take it and put it on her abdomen. I'm putting my hand on her iliac crest, which is here, fingers pointing away from her body, putting my other hand on her knee, pressing down with equal pressure. 2, 3, releasing the pressure to get her out of this movement or out of this position. All I have to do is to take my hand above the ankle and just slide it down. Wonderful. And you would do these movements on both sides of the body or bilaterally. Can you turn over, please, and toes off the edge? Once you get your client face down, the movements you can do are going to be tapping the thigh on the table. Now I'm moving my outside hand to join my inside hand on the ball of the foot. Fingers press, tap, and notice I'm just rocking myself forward using a lot of body weight. This way. Now, then I'm going to walk to the side of the table. I'm taking my thumb, putting it between her 2 first toes, grasping it, doing a little bit of a shaking of the heel, like this. Then I'm going to take the heel and put it to high knee, holding it, 2, 3. Then I'm taking my hand, sliding it down, getting the foot, the plantar flexion is no longer involved. Now it's just the quad. And stretching it, 2, 3. Now if you want to walk around here, you can see my hand going just inside the knee, lifting it up a little bit. Because she's tiny, I can do this with one hand, but there is an adaptation you can do by using your hip anchored with it, moving it out from the midline just a little bit. Then you take your top hand over the sacrum, lifting, stretching the quads and the psoas, holding, 2, 3, place the foot back on the table, in with a little rock. Then what I'm going to do is I'm going to go to her shoulders, rotating the arm till the hand is down. You might want to walk on this side of the table now. Doing a little bit of a shoulder rock, grabbing her shoulder, my hand on the front of her is contacting her area as far as her coracoid process. The bottom hand is meeting my top hand. My fingers are touching, my hand is touching. Play around with this movement, and then you're going to end up with some rotations of the back. Call this baby charlottes. With some hip swings, some nice movements, paraspinals. This Swedish gymnastics can be done with your client before the massage, after the massage, totally clothed. Enjoy massage, and then I'll talk to you later. Bye now.